Welcome to Aria Jefferson's Introduction to Sunrise. This instructional video takes approximately 12 minutes to view and is meant to serve as a basic introduction to the Sunrise clinical system. Select either the Citrix icon or the Sunrise icon from your desktop. Then select Sunrise PRD. Enter your username and password. The first time you log in, you may be required to create a new password. The sidebar at the bottom left of the screen. This will open the different applications available in Sunrise. Depending on your security rights, you may have access to Sunrise Acute Care used for inpatients and Sunrise Emergency Care used in the ED. You may have access to both. Selecting Emergency Care will show you a current list of patients in the emergency room. Select Acute Care for the inpatients. The sidebar can now be closed to give you a larger view. The list displayed under Current List will vary depending on your job title. Select the appropriate list and then select a patient from that list. That selected patient is now displaying in the header area. Here you can view various information such as date of birth, medical and account numbers. The top right-hand corner has 4 icons. To the furthest right is a help icon, the shutdown or off button, user preferences. This icon allows you to change your password if needed, and recently viewed patients. The top row is a menu, which would allow you to perform functions like viewing and setting your own preferences and defaults. Next is the toolbar. Previous and next arrows allows you to scroll from patient to patient on your list. Refresh brings in new information, including orders and results. Find Patient and Find Visit icons allow you to search for patient that is not on your current list. You can search by name, medical record, or visit number. Highlight the correct patient. Double-click that patient or select Show Visits. Select the patient visit. Double-click or select OK to put this patient on a temporary list. When you log off of Sunrise, you will lose any temporary list. To save this patient, you can make a personal list. Select the Save Selected Visits icon or button. Create a name for your list. Personal lists are saved with an asterisk and are located at the bottom of the current lists. To remove a patient from a personal list, use the Remove Selected Visits icon. The next icon on the toolbar is the Allergy Summary. This displays the patient's current allergies and allows you to add new allergies here. The red boxes are mandatory. Typing in the allergen field is a quick way to search for allergies. Select OK when finished. The Worklist Manager icon, or Task Viewer icon, is for charting and viewing medications, respiratory treatments, and other tasks. The Enter Document icon allows clinicians to create various inpatient documents. The Print Reports icon. This icon has multiple items that can be printed from here. A patient's emergency room chart can be printed here using the two selections of ED Chart 1 of 2 and ED Chart 2 of 2. Changing the category to Patient List by Current List has options to print a patient list or current order summaries. More header info displays admission info and care providers. The Signature Manager will list any orders or tasks that require your signature. It is recommended to check the Signature Manager at the end of every shift. Drug Info opens a medication education search. Some items here are available in English and Spanish. The Prescription Writer allows providers the ability to print or e-prescribe items at discharge. It also holds a list of the patient's home medications. Health Issues displays the patient's current diagnoses and past medical history. The lower window allows some users the ability to add any new health issues that are needed. The Education Log is used to view education that has already been given. Health Manager displays any previously given immunization and allows for entry of vaccination history. Influenza, Pneumovax, and tetanus should be documented here. Discharge Instructions is where patient education or excuse forms can be printed. Select the discharge instructions for current patient. Using the links at the top left will enable you to search for the desired educational handouts. Missogram Wrench contains miscellaneous information such as physician and care management phone numbers and a list of lab tube colors. The tabs here display various areas of the patient's chart. The Patient List tab has multiple columns that can be moved or resized. You can also add additional columns by using the Select Visit List column icon. For example, you can add an age column by selecting from the left box and then select Add. The Orders tab lists all the current orders for this patient. Options and filters on the left-hand side enable you to search for specific types of orders. You have the option here to view orders from previous visits. Opening a Quick Pick menu allows you to change the dates and various filters. The Results tab defaults to show results from the last 4 days. You can change these dates to search for previous results and results from prior visits for this patient. A flag displaying here tells you that there are specific results for that selected date. Double-clicking the flag will open the results. Change the display view back to Summary to view the summary grid with the flags. A yellow flag signifies a text result. A red flag is an abnormal numeric result, and a green flag is a normal numeric result. Tab allows you to view certain patient information, such as care providers and visit history. The Documents tab shows all current and previous Sunrise notes for this patient. A single click opens the note to the right to allow for viewing. A double click opens the note in a larger window for viewing. If you are the author or co-signer, you are also able to modify this note from here. The next tab are flow sheets. This will display the current vital signs and intake and output flow sheets. The Clinical Summary tab displays all of the content of the entire chart on one page. Several different views are available here. The rest of the tabs shown here after the Clinical Summary tab are only available for physicians and advanced providers. This concludes the introduction to the Sunrise Clinical System. If you need further assistance, visit the Sunrise site on ARIA's intranet under Clinical for more educational resources, or contact the help desk at 215-612-4026.